Hello everyone, my name is Ariel Pelletier and this is my first discussion post for this class. After watching Becoming a Culturally Competent Nurse video, it made me really question how I would handle the situations she gave at the end. Janae Lauderdale did a wonderful job of what it means to be a culturally competent nurse. How I see myself transitioning from extreme humility to extreme openness in my nursing practice would be by acknowledging that I do not know everything about different cultures, but I want to find out more and be receptive to my patients' needs. What Janae experienced with her Muslim patient who rearranged the room and no one knew why until Janae sat down for a one-on-one conversation to learn more about her patient. That is what I want to do with my patients, to show that I am open to learning more for them. If I were to handle cultural differences right now, I'd be comfortable with active listening to my patient. And my other tools that I want to work on is building trusting relationships. Due to being a young nursing student, I feel it can be hard to make a patient trust you. But with time and more experience, I hope to build a very strong, trusting relationships. After looking at the American Association College of Nursing Toolkit, cultural awareness stood out the most to me. It stood out to me because I think it says a lot about you as a person, but also to the patient that you want to show respect to them, as well as show them sensitivity. This goes back to me wanting to work on building trusting relationships by showing cultural awareness will make my patient feel comfortable to let me do my job, which is to take care and advocate for them. From the article 7 Steps to Become a Culturally Sensitive Nurse, it talks about barriers our patients could face and some of the steps we can use to get over the barrier. A few I have already talked about are trust, active listening, and awareness. A different step I haven't mentioned yet is avoid making assumptions about your patient. In the previous example I stated earlier, when Janae had a Muslim patient in the ICU, instead of thinking they are trying to make the nurse's job harder by rearranging, she simply asked why they were doing that. Janae found it was just to respect the religion when one is dying. It's so easy to make an assumption and be wrong when you could ask and make both yourself and the patient informed of what they would like. In the Becoming Culturally Competent Nurse video, Janae gave us a list of scenarios at the end. And while thinking about what I would do if I were to have an HIV positive patient, the first thing I would do is treat them as any other patient. I would be kind, sympathetic, listen, and not judge their circumstance. I would sit down and listen to their concerns that they might have and advocate the best I can for my patient, because what they're experiencing matters. The most important thing that I took from this lesson is, as I grow, mature, and develop as a nurse, I'm going to grow my confidence and self-assuredness as a professional. I will worry less about the mechanics of nursing, as it will become second nature to me, and move into confident nurse who advocates for her patients' culturally diverse lifestyle and personal needs. Thank you.